we've got a warning tonight for parents and grandparents who are being told and being urged actually to learn the symptoms of a fast-moving virus called RSV. Now, I know someone who's had this. It's particularly nasty. There's a major report fearing that more than 15,000 babies could be hospitalised with this unpredictable virus in 2023. Joining me now, someone who knows much more about this than I do, University of Sydney's infectious diseases paediatrician, Professor Robert Boyd. Great to catch up with you and see you again. Can you explain what RSV is, Professor?
It's one of the three most common viruses that affect the respiratory tract, the lungs and the throat. Now, flu is the one that we almost all know about. COVID, of course, has been important in recent years. And RSV, respiratory syncytial virus, affects especially young children, but also the elderly. It's a virus that leads to fast breathing, coughing, runny nose and fever, and it can go on to cause pneumonia and secondary bacterial infections. So things like pneumococcus on top of the virus. So not only is it trouble itself, it can lead to other bacterial infections.
Why is it so age-specific? Why does it attack the younger people in the community and older Australians? Why is that?
Well, babies get protection in the womb from their mother that lasts a few weeks or a few months. And from 6 or 8 weeks of age, the incidence goes up because their immune system hasn't seen the virus before. So they're seeing it for the very first time as an infant. And it loves going to the lungs. That's where it likes to sit and where it likes to cause infection. And because it causes cough, it then causes transmission between babies and from babies to their parents and older siblings, and vice versa from older siblings to babies. So it's really a case that once you're an older child at primary school age, it becomes more like the common cold, and you can still catch the infection, but not as severely because you've seen it before and your immune system deals with it better.
Someone I know who came down with it described it as being twice as bad as how they felt when they had COVID.
Yeah, well, it varies by individual. There's no doubt about that. You can get RSV severely, and I've over my career been managed many children in hospital and in intensive care who've had it really, needing to be ventilated and at risk of dying. So flu can also be, in a minority of people, very severe, as can COVID. The double truth is that these viruses, in most people, aren't too bad, but in the vulnerable, the very young or the very old, flu and RSV can both be really quite severe.
Well, the young babies obviously can't tell you, how they're feeling and what their symptoms are. What should parents, particularly younger parents with, maybe just their first newborn, what should they be looking for, and what will be the hint that their child may be coming down with RSV, Robert?
Well, certainly fast breathing and retractions of the chest, because they're trying so hard to get oxygen in that the chest retracts. Some very young babies can actually stop breathing, so that's called apnea. Fever, runny nose, cough. And if parents are concerned, they should seek help. And the things that most worry us is if they have very fast breathing or stop breathing. Sometimes the colour of the child can go from being pink to slightly blue. That's a really worrying sign because they're not getting enough oxygen in.
Have we got an approved vaccine for RSV, and who would you recommend would go and get it?
Well, there's a lot of research going on, and there's studies published in the last few months that are very promising, and Canada and the US have recently licensed a vaccine for older people over 60. So as I alluded to before, it's people who are very young or very old who can get RSV most severely. We don't have a vaccine yet in Australia, either for the young or for the old, but it's being assessed by the TGA. They're looking at it closely, and it's possible that we could have a vaccine by next year. And I think it could be focused on not just the very young, but those who are most vulnerable. Now, The children, the way the vaccine studies are going is they vaccinate the pregnant mum between 24 and 36 weeks, and then the mum then passes her antibody in the womb to the baby and provides protection for the next 6 months after the baby's born. So that may well be what we end up going with, but we're likely to do it for people who are at greater risk. So multiple pregnancies, people who have a history of lung disease. And there's another treatment, not a vaccine, but a treatment that you can give very young children, which is a monoclonal antibody, and that too lasts for about 6 months. That too can be at least 80% protective in preventing severe RSV. So there's a number of treatments and vaccines coming along that have real promise and could be available within a year.
Well, that's great advice. Thank you very much for joining me. I've had my flu vaccination. I urge everyone to go and get one.